Hello, and thank you for taking the time to be part of the West River Health Services Community Health Needs Assessment process. While we normally present this information in person so that we are able to interact and ask and answer questions, as you are well aware, the pandemic is keeping us from being able to come out to your community right now, and we unfortunately are no longer able to hold off until we do not have to social distance because our deadline is nearing. Today, we are going to present to you the findings from the key informant interviews that were conducted, the online and paper survey, and secondary data. After you listen to this presentation, we'll ask you to complete a brief 3-question online survey that will allow us to gather your top 4 concerns. So, why assess community health? Nonprofit hospitals are required to conduct a community health needs assessment every 3 years in collaboration with public health. It's an opportunity for the health organizations in the area to take stock of the community assets and challenges in a way that has community buy in because they're providing direct input. Since this is done every 3 years, there's an opportunity to benchmark and track changes and progress through those years. The Center for Rural Health conducts the CHNAs for over 86% of North Dakota's critical access hospitals. Throughout this process, we utilize the same assessment method so that we are able to aggregate our findings to present to policymakers to help improve the health of communities at the local and state level. It also provides a means to share findings amongst various communities so that ideas can be shared. Now, this is one of the features on the Center for Rural Health's CHNA website. You can see which communities are conducting their CHNAs collaboratively, the orange multiple headed icons, which are conducting it mostly independently with limited assistance from public health, the hospital icons, the public health units that have completed CHNAs, those are the little public health icons, and those are generally done as part of their accreditation, and accredited public health units must complete theirs every 5 years. And the green H's show the locations of the tertiary hospitals. On that same web page, there is a listing of all the towns shown with the various icons. You may select up to 3 communities at a time. Now, this allows you to see what the top priorities for the community or communities that you selected were in their last CHNA cycle. Pulled up, we have West River Health Services top 5 priorities as identified from their last cycle. Now, if you go to another page on the CHNA website, you can see the priorities listed and then a listing of all of the communities that selected those as top priorities. Another page on the site provides the last 2 reports and implementation plans for each facility. Now, I'd like to take a moment to recognize that this isn't just healthcare that determines the health of a community. There are different models that depict this, and we're going to go over a couple. Now, as you can see here, healthcare, which includes such things as insurance coverage and access to care, contributes to about 20% of your health outcomes. Physical environment or neighborhood is about 10%, and that includes such items as housing, transportation, and safety. The social and economic factors encompass roughly 40% when it comes to determining health outcomes. Now, some models do separate these two, but economic factors include things like employment, income, expenses, while social factors are items such as community engagement, discrimination, and stress. And finally, health behaviors encompass the remaining 30%. Behaviors such as healthy food selection, substance use, and unprotected sex fall into this category. Now, keep in mind, as I said previously, there are a number of different social determinants of health models, and while they are all relatively similar, most of them are going to vary slightly. Here's another example of another model that breaks them into 6 categories that determine health outcomes. We're not going to go through all of these right now, but it lists different examples under each category to give you an idea of what falls into them. The next data we are going to look at is secondary data. This is information that other sources, generally national groups, have pulled together. The Robert Wood Johnson Foundation out of the Wisconsin Population Health Institute creates the county health rankings on an annual basis, and these illustrate the community health needs and provide guidance for actions to improve health. It compares each county to the average state rates and the rates of the top 10% of U.S. counties on numerous topics. The handout that is attached to the email that you were sent with the link to this presentation includes secondary data for Adams County. On page 1 are the county health rankings. The measures with a red dot means that the county is performing worse than the state average. The measures with a blue square means that Adams County is not meeting the top 10% of U.S. counties. All right, taking a look at where Adams County sits in top 10% of U.S. counties, they're in the top 10% of low rates of poor physical and mental health days, food environment index, alcohol impaired driving deaths, ratio of population per primary care physician, rate of unemployment, children in single parent households, air pollution, and severe housing problems. Now, some of the areas where Adams County is not meeting the state average: food environment index, physical inactivity, access to exercise opportunities, uninsured population, the ratio of population per dentist and mental health provider, mammography screenings, children in poverty, income inequality, and social associations. You're going to see some of the same over here on Adams County, where Adams County is not meeting the top 10% of U.S. counties. Days or poorer fair health, adult smoking, adult obesity, physical inactivity is one that pops up in both, access to exercise opportunities as well. Then we have excessive drinking, sexually transmitted infections, uninsured population, ratio of population to dentists, and population to mental health provider, rate of preventable hospital stays, mammography screenings, flu vaccinations, children in poverty, income inequality, social associations, and violent crime. And when it comes to children's health needs, we look to kidscount.org to provide county-specific data. These are the areas in which Adams County is performing poorly to North Dakota average. So rate of uninsured children is over 3% higher than the state average. Rate of uninsured children below 200% poverty, 11% higher than the state average. Rate of Medicaid recipients just a little bit higher than the state average at 0.4%. And Adams County only has just over 1% of less licensed childcare capacity than the state average. Now we're going to go over survey results, starting with the age of our survey respondents. Now, overall, we had 126 community members take the survey, 2 paper and 124 online, with 2 of those being QR codes. You might see the N equals 96 right there. That refers to how many people answered that individual question. So not everybody answered every question. So as you can see, the majority of respondents were between 55 and 64. Traditionally, we do see more involvement from community members ages 55 and older. However, this time around, we saw an equal number of responses younger than 54 as to those older, which could indicate a positive trend of reaching the younger demographic. Resident zip code, 73% of survey respondents live in or very near Hettinger. Lemon and Bowman coming in at number 2 and 3, and Scranton and New England rounding out the top 5. Again, an area in which we traditionally see one group heavily outrespond the other. Women typically participate in the survey much more than men, and you can see that here, 76% to 23%, so that trend isn't stopping. We had one other response, but that was not specified. So on to education level, 52 of the respondents for this question had a bachelor's degree or higher, but 87 respondents reported having some college or technical degree, with only 9 having no college or and only 1 of those having less than high school. Employment status, the label force pulls through here with 87% of respondents having at least part-time employment. Obviously, a big shout out to the multiple job holders who were able to find time to complete the survey. And then we had 13% of the community of the survey respondents being retired. Household income is another area in which we see the majority of respondents making at least $50,000 annually. Here, it comes in at 64 of the 88 responses. Now, while there is participation at the lower incomes, as you can see, it is important to note that groups of community members that are underrepresented to a degree in household income and the barriers that are preventing them from being involved in things like this. So health insurance brings up a great time to mention that you may start to notice some of the number of responses being higher than the number of surveys we received. This is because respondents were able to choose from more than one option for certain questions, annotated by the asterisks there by the number on top and a little note at the bottom. Insurance through employer is number 1 here, of course, with Medicare and self-purchase insurance coming up behind it at 2 and 3. Some of the other options that were written in included Ministry Share Plan, MCR Supplement, and Blue Cross Blue Shield. The key informants had a number of great things to say about the community. These are only some of the comments that we'd like to share. Small, safe town, great for raising a family. The healthcare and school system was lauded throughout the interviews. Great place to raise kids, strong faith community. The community comes together to help one another. Volunteers come out, and the organizations really hold community-oriented events. So really great responses here overall. Too many to fit on the page overall, so we put some of them together, but fantastic. Back to the survey, we asked the respondents, what are the 3 best things about the people in the community? People being friendly and helpful and supportive at 81% right at the top, and people who live here being involved in the community coming up behind that, with feeling connected to people who live here coming pretty close. In the other category, we had apparent generalized apathy written in, the community cares, the community works together, and low crime. And speaking of low crime, when we asked respondents about the three best things about the quality of life, little to no crime being a safe place to live, right at the top at 88%. Family friendly at number two, and closeness to work activities, 44% at number three. The only other written in portion or at response was healthcare. And speaking of healthcare, some of the best things about the services and resources in the community, right at the top with 80%. Active faith community coming in at number two, 51%. Quality school systems, 35%. Access to healthy food and business district rounding out the top five here. Some of the other responses to this question included the library, a closed closet, the excellent local radio station, museums and parks, and programs for elders. When asked about their favorite community activities, local events and festivals came in at number one at 68%, recreational and sports activities at 47%, and activities for family and youth at 36%. Some of the written in responses here included a July 4th tradition, the golfing, and school activities and athletics. These are the results of asking key informants to rate the collaboration and community engagement of various organizations within the community on a scale of 1 to 5, 1 being not engaged, no collaboration, and 5 being excellent collaboration, very engaged. Now remember, as mentioned in our interviews, this isn't rating their ability to perform services, it's how involved they are in the community and how willing they are to work with others. So really good scores to start off with. You have 4.25 for the hospital and emergency services, speaks greatly to how they're doing in the community. Economic development organizations at a 4, a 3.75. You go all the way down to the last two to really get under 3, and even then, those are at least average or above on a scale of 1 to 5. So great things to say about the areas. Obviously, some places to improve, but generally good positive response from interviewees. Okay, moving on to the community concerns as identified in key informant interviews. So community environmental health concerns, attracting and retaining young families, not enough jobs with livable wages, bullying, cyberbullying, and having enough child daycare, having quality school resources, and not enough places for exercise and wellness activities. And you're going to see kind of a theme you should probably be recognizing by now, that some of these responses have been at the top for other questions as well. Availability, delivery of health services concerns, ability to retain primary care providers and nurses, availability of substance use disorder treatment services, ability to get appointments for health services within 48 hours, extra hours for appointments, and not enough healthcare staff in general. For youth, alcohol use and abuse, depression, anxiety, not enough activities for children, and smoking and tobacco use. If you look down at adult, you're going to see that mirror most of them, just a little bit different order with depression and anxiety at the top. Alcohol use and abuse still identified for adults, as well as smoking and tobacco use. And you're basically just swapping out not enough activities for children with drug use and abuse, including prescription drugs for adults. Concerns for senior population, cost of long-term nursing home care, depression and anxiety, again, we see that for each of the generational groups, seasonal viral outbreaks such as influenza or coronavirus, and quality of elder care. Moving back to the survey, respondents were asked about the concerns in the community environmental health, attracting and retaining young families, 65% with a commanding lead over number 2, not enough jobs with livable wages. Having enough quality school resources at number 3, and then you see changes in population size, which somewhat goes hand in hand with attracting and retaining young families. Either way, they're both areas that we've seen before in this presentation, and bullying, cyberbullying, rounding out the top 5. Some of the written responses for other option were not enough activities for children, not enough people willing to work at local jobs or small maintenance jobs, efforts by the chamber and community promotion being subpar, anti-intellectualism, not enough media literacy, reliance on the government, and current access to health care. When asked about their concerns for availability, delivery of health services, the ability to retain physicians and nurses in the community was at number 1, 44%. Tied for 2, cost of health insurance, not enough healthcare staff in general. and availability of primary care providers, and extra hours for appointments rounding out the top five. Some of the other responses included oncology services, having no energy medicine, or not enough training in healthy eating and vitamins, and the facilities being afraid to see people unless they are screened for COVID 19. For youth population concerns, you're going to see some of the same, again, as with the key informants. Alcohol use and abuse at the top, depression, anxiety, not enough activities, smoking, and then drug use abuse. Some of the other responses here included bullying and ignorance toward the larger world, and the Gardasil vaccine and others and their side effects. For the adult population, the concerns, again, very similar to the youth. Alcohol use and abuse at 52%, depression and anxiety at 47%, stress at 40%, drug use and abuse at 22%, and obesity, overweight at 19%. Some of the written in concerns here include disregard for COVID, bullying, isolation, and that is both due to COVID and outside of COVID, sexism, and iatrogenic diseases. For the senior population, cost of long-term nursing home care at the top with 41%, followed by depression and anxiety, availability to help the elderly stay in their homes, long-term nursing home care options as opposed to cost, and the ability to meet the needs of the older population. For some of the written in responses here, community members said availability of durable medical equipment, enough staffing for nursing homes. So again, we see some of the healthcare facility staffing being an issue. COVID, fraud schemes that target the elderly was brought up several times. Lack of access to technology, and treating everything with a drug instead of looking for a root cause. When asked about possible or perceived barriers to care, survey respondents had not able to see the same provider over time as their number one, with not enough providers following that up, no or limited insurance, not able to get an appointment or limited hours, and not enough evening or weekend hours. So those last two really coming down to the hours that the facility is open, which facility is open, or taking appointments. Some of the other responses in here included long wait periods to see primary care physician, a lack of time to go to the hospital, confidentiality concerns, the quality of care concerns, fear of COVID again, and stigma, and wanting to see doctors that don't immediately go to drugs to treat an issue. When asked where people go for trusted health information, primary care provider right at the top, as we all probably hope that it should be, 82%, very good lead over other healthcare professionals, but also would also be probably the next best answer, other healthcare professionals. Web searches at 49%, and public health professionals at 24%. Word of mouth coming in at 18% down there. Some of the other options for this question included pharmacy staff, literature, peer-reviewed articles, social media, and other facilities. We asked respondents in an open-ended question what healthcare services they would like to see added locally. And here are some of what came up. Cancer treatment, dental care, of course, comes up often. Dialysis came up often throughout the surveys and the interviews. Dietitians, drug and alcohol counselors, social work, customer service training, okay, urgent care. So this is a good list of the services that were people mentioned. When asked to prioritize services to possibly add to the hospital, most people seem to prefer substance abuse treatment at 50%, with urology coming in at 28%, and then we see another drop off with the last two. When asked about the awareness and utilization of general and acute services, most respondents, 96%, an overwhelming majority at 96%, are aware of the clinic, fantastic, or have utilized it in the past year. Emergency room services, optometry, hospital at 57%, and surgical services coming in at number 5. This question presented a scale of 1 to 5 for community members to rate their inclination to use telemedicine care through different mediums. Now, overall, community members seem generally more inclined to use different mediums of telemedicine care than not, while residents seem to favor using a phone or tablet app. You can see the other options aren't very far behind. And the important thing is the 1s and 2s are fairly low. The one other response specified was lab consult, which of course is a service and not a vehicle for telemedicine. This question used a similar scale to determine how important several services or extended hours are to the community. As you can see, most respondents felt that each of these services or extended times are important to the community, or fairly important to the community, with extended morning clinic hours really being the only option to receive a lukewarm response. An open-ended question when asked the biggest challenges facing the community, you can see that these are the issues that really push through the others to be noticed. Community disregarding COVID-19 guidelines and COVID issues in general brought up many times throughout the interviews and the survey. And of course, attracting and retaining new families and businesses. And by now we've seen how the theme is laid out about attracting and retaining new families over the presentation. Some of the other challenges identified: healthcare facilities being understaffed. We've seen that up to now a few times. Not enough activities, amenities. Community not working together, which is kind of an outlier considering how many people praised the community's ability to work with one another. So local government not invested in economic future. Alcohol abuse, we saw that in some of the generational, some of the age group concerns, as well as cost of health services and lack of exercise opportunities. So these are the top 4 concerns that emerged from each category for the survey. So community, environmental, health concerns. Again, we see attracting and retaining young families, not enough jobs with livable wages, school resources, and changes in population size, which kind of goes hand in hand with attracting and retaining young families. Availability and delivery of health services and concerns. Ability to retain physicians and nurses in the community, cost of health insurance, not enough healthcare staff, and availability of primary care providers. Getting into youth population health concerns in almost an identical version of the key informant responses: alcohol use and abuse, depression and anxiety, not enough activities for children and youth, smoking and tobacco use. And then for adults, slightly more of a change from the key informants, where we have alcohol use and abuse, depression and anxiety, stress, and drug use and abuse. Now, senior population health concerns included cost of long-term nursing home care, depression and anxiety, availability of resources to help the elderly stay in their homes, and long-term nursing home care options. Fantastic. So what do we do next? Well, we just presented our findings. So now it's time for you to tell us what you feel the top priorities are. So I'll ask you to click on the link to the Qualtrics survey. We're going to call this survey part 1, and select the 4 biggest concerns you have. Now, the concerns that you will be selecting from are the top concerns that were listed for the survey results and key informant results. Most of the top issues overlapped, so there are around 4 topics from each category. However, you aren't picking from each category in this one. We're just putting them all together and asking you to pick your overall top concerns. So now we would like you to complete the Qualtrics survey by 5 p.m. Mountain Time on Tuesday, January 12th at the latest, and you can find the link for that survey in the email with this presentation. We will then analyze the results and send out a second survey, known as Survey Part 2, which will have you pick your number 1 concern out of the top results from the Survey Part 1. Again, thank you so much for your time and thoughtfulness in participating in this community health needs assessment, and you will be receiving another email on the afternoon of January 13th. If you have any questions, please feel free to reach out to Kylie Nissen, our program director, or myself, Sean Larson, at any time. Thank you again, and stay healthy.